So this is the endoscopic hamstring harvesting video. Basically, on the 18th of October, broke my leg. A man just walked in with a mask, glasses, skull cap, and then he used an intramedullary nailing operation, manipulated it to perform various harvesting techniques to remove my tendon and veins from my body for use in other surgeries. Now, I've said in previous videos I've had my hamstrings harvested but never had a video to elaborate on how. So this is the video on how it has been done. It starts off with just the scar comparison and just me showing you how he's done the endoscope, where the scar is for the endoscopic harvest and where my scar is, and how he's put the endoscopic tool through the screw hole, and then it goes into an explanation of what a ACL reconstruction is with someone else's tendon and what it is with your own tendon, and then it goes into viewing the two MRIs. It's just a MRI of my left knee, pre-operative, just to show you what a normal hamstring tendons look like on the medial side, on the inside, and then it'll come over to my right leg, MRI taken 6.5 years later, just to show you all the scar tissue along my hamstring tendons. Alright, let's get into the video with the scar comparison, or like just measuring up the scars. Now, of course, in the right hands with an ethical surgeon, tibial nail is considered the gold standard of treatment for when you break your leg. However, it can be manipulated to do extremely sick things. I broke my I broke my leg here. I'm not sure if you can see where the bone is. And through this screw hole here, he harvested my hamstring endoscopically, slid a blade up there, harvested it endoscopically. You can really see how it fucks you up when they cut half the side of your patella tendon off. It's a terrible operation. Use the endoscopic tool to harvest and take a strip off the tendon. That triangle zone is where the incision was made to endoscopically harvest my tendon. Right in there, they did it through a screw hole. Another thing I want to reinforce as well, I really don't know how much this guy stripped me down. Like in a normal hamstring harvesting operation where you use your own, do they only take like the center? Or in this one, has he just taken the center, taken the side, taken the other side, and just stripped me to the fucking bone? Because it feels like he stripped me to the bone. Yeah, and it's really changed a lot of the way my right leg moves, and my right glute just doesn't activate. And this is why, because part of the system and muscle connecting up to it have a lot of that tendon removed, and what pulls that muscle, that tendon, so that muscle just doesn't work, and it all connects up to my glute. So this explains perfectly how I've been feeling in relation to the muscular imbalances as well. So let's get into it.
One of the most important decisions to be made prior to an ACL reconstruction is the choice between allograft and autograft. But what exactly does that mean? Well, autograft means using tissue from your own body, while allograft means using tissue from a donor. Let's start by discussing the two most common autografts, the hamstrings and the patellar tendon. With a hamstrings autograft, your surgeon will make a small incision to harvest one or two of the hamstring tendons adjacent to the knee, usually the gracilis, the semitendinosus, or both. These tendons are then bundled together to create a stronger, thicker graft. Or you prefer to avoid using your own tissue? We understand. That's where the allograft method comes in. Allograft surgery has been a tried and true method of ACL reconstructions for a long time. There are several advantages to this technique. Obviously, you'll have no additional incisions to worry about. Plus, allograft procedures are shorter, as the repair tissue is already there and waiting. Still, you may have concerns about placing tissue from another person in your body. You may be worried about infection or tissue rejection, or you may think it's just plain weird. The truth is, that modern sterilization techniques are so thorough that potential problems are almost zero. Plus, there are strict donor selection and tissue processing guidelines that all help to keep you safe. So if allograft surgery sounds right for you, or you want to keep it in-house with an autograft, you're more than likely to be happy with results.
So this is the preoperative left knee MRI, just to show you what normal hamstring tendons look like. Now I'll give you a look at what these tendons are. See these black bits? They're your hamstring tendons and they connect down to the front of your knee. So all black, no scar tissue. Here, all black, no scar tissue. And these are what normal hamstring tendons look like. Now we look at the MRI of my right leg, taken the 19th of the 5th, 2022. And now we'll look at my right knee MRI taken in 2022. So around 6.5 years after the operation, and we'll inspect the hamstrings. Bring it all the way out. It just all looks like scar tissue. There's no solid hamstring. So to see, like in the other one we saw, it looks like the endoscopic harvest tool has gone in there. Gone in there. And then slid up the side of the hamstring. It just looks like scar tissue. So you just go through and there's just scar tissue on my hamstrings. So they use the endoscopic tool to harvest and take a strip off the tendon. They slide a rod up there. That little stripper there takes a strip off, and they use that for the ACL reconstruction. And what I mean by scar tissue as well, you see how they take the center. So they're taking the center, and then all the tissue on the outside is going to come together and heal. Now back to the post-operative MRI, the one that's been harvested. Now it's fucked because I don't know how much tendon this bastard took. If there's like a limit, or you take a little bit for yourself, or if you just stripped it fucking bare. Where he slided that endoscopic harvest tool, entered in there, slid it up the side, and it's just all scar tissue. See all that scar tissue in there? You know, he's taken the strip off and then it's parted together again. Scar tissue. Where that strip's parted.
With a hamstrings autograft, your surgeon will make a small incision to harvest one or two of the hamstring tendons adjacent to the knee. Usually the gracilis, the semitendinosus, or both. These tendons are then bundled together to create
fucking Iraqi, man. Then see this? Kind of like, well, it's like where the hamstring harvesting tool took it, and then now there's scar tissue. And see how the tissue has like come back together. Now we go back and look at the normal hamstrings again. None of that scar tissue. And when you're all the way over on the MRI, You can see them and they look all fine and normal. Nice and black, solid, no scar tissue. Now we'll go back and take one last look at the other tendons. Alright, post-op MRI of the right knee, 7 years after harvesting. Just that scar tissue right there, again you see it through there, and it's like the tendon was split and stripped off, and then it formed back over the years. Alright, see how the tendon stripper goes into the bundle there, and then goes in, so it leaves that bit at the front there that doesn't get stripped, and then it starts stripping after that bit. So it slides in and then starts stripping about an inch in there. So the scar tissue is from there to there. It's not at the start. See how that tendon's still covered? And then we notice the exact same thing on the MRI. See how this bit here, it's still full tendon, it's not scar tissue. And then right there is where the scar tissue starts. But that isn't, because it's been slid through there under this bit, which is still tendon with no scar tissue, and then it started stripping here and then stripped up the side. And again, yeah, that's fucked. Entry point, slid under there, and started stripping up the side. Again, see how the stripper comes in and starts stripping from there onwards. Doesn't strip from the start. It'll slide it under the first bit and then start stripping. That's exactly what we're looking at here. Slid it under the first bit here and then started stripping from there. Let's take a look at the screw hole it was harvested through and how else they tortured me. Right. Here's the rod there, and the screw came in from that side, and we'll go through the image. You can see the fate mark of the screw, and let's see where it ends up. See, it's moving to the outside now. See this hole? That hole there? It doesn't just stop at the knee. It goes right through and smashes through the side on a hole there. Which is put a hole in the side of my knee, the side of my lateral collateral ligament. Look at a side view. See, there's the hole in the side. It's a weapon imprint, believe it or not. Boom. Let's track the screw mark. Look at that. See this white screw coming out the side. Boom. Then a hole in the lateral collateral ligament. Another torture technique.